Well, welcome to those who've already joined us. We will get started in just a minute. We'll leave another 1 or 2 minutes for other colleagues to join, and then we'll be jumping into our webinar today. So welcome, and when you're ready, feel free to also introduce yourself in the chat. For those who've just joined, welcome to the webinar today. We're just leaving 1 more minute for additional colleagues to join, and we'll get started very soon. Please feel free to introduce yourself in the chat while you wait. Let us know where you're calling in from today and your name and the organisation you represent. Excellent. Well, we might make a start. I expect we'll probably have some further colleagues joining us in the next couple of minutes, but to maximise the time we have together, we will get started. So firstly, let me warmly welcome you all to today's webinar, which is titled Supporting Children and Families to Flourish. My name is Rebecca Nape, and I am the Senior Technical Advisor for the Better Care Network, and will be moderating today's webinar. This is, as you can see on the screen, the 23rd webinar in our Transforming Children's Care collaborative webinar series, and we're delighted to have you join us all today. The webinar will be recorded, so for those who have been unable to join us live today, we'll be able to share that. We are crossing many, many time zones, which is always a challenge, and appreciate those who are joining at various times around the world. So please do once again introduce yourself in the chat if you've not yet done so, and make sure you're directing that to all the panelists so that we can all see, and the participants, we can all see who you are and where you're calling in from. I mentioned we've already got, we'll be recording today's webinar, so just please be mindful of that in terms of the Q&A at the end, if you need to be. So thank you for that. And in this webinar, without further ado, we'll move on to just looking through the agenda that we have today very quickly. We are going to be exploring insights from 2 Australian initiatives, the first being Professional Individualised Care, which you'll probably hear referred to as PIC throughout the webinar, and the Centre for Relational Care, which is another iteration of the CRC, a term that we use, or an acronym we use quite a lot in this sector. And both of these initiatives are focused on reorienting out-of-home care models and the broader child protection system in Australia, in New South Wales specifically, towards systems and services that emphasise relationships and protection through connection. We have 2 presenters that are joining us today, Jared Wheatley and Sophie Bruce, and I'll introduce them properly in just a moment. But firstly, just to cover a little bit of the themes we'll be covering and the structure of today's webinar. So Sophie and Jared are going to be sharing learning focusing on 3 key themes. The first is pathways to deinstitutionalisation, particularly how the PIC model has created new family-based care options for children in the out-of-home care system in New South Wales, particularly children who have complex trauma, have experienced multiple foster care placement breakdowns, and for whom the system has otherwise deemed as requiring residential care. And this particular model has enabled the New South Wales government to reduce reliance on residential care, including group homes, and enable children to leave inappropriate emergency alternative care placements at half of the cost. So this learning may provide some relevant insights for practitioners who are working in a diversity of different systems, either to prevent the overuse of residential care, including reliance on small group homes for specific cohorts of children. The second theme will explore how the role of the social service workforce or workers has been reimagined, including pushing back against compliance and risk-driven case management paradigms, notions of professional distance, and instead engaging professional social service workers as highly skilled, one-on-one caregivers who serve as the attuned adult, forming meaningful relationships with the child and designing and delivering individualized therapeutic support within the context of a stable connection. And the third theme deals with the paradigm of children's protection and care, reorientating systems from a focus on protection towards protection through connection. And Sophie and Jared will unpack some of the incentives that have been hardwired into the child protection system in New South Wales and Australia more broadly, and other Western country contexts that prioritise things like surveillance, compliance, professional distance, and risk management approaches that fracture relationships, contribute towards removal, and result in relational deprivation for children and perpetuate intergenerational cycles of harm. We're going to hear about the growing movement of practitioners in New South Wales and beyond calling for a child connection system. Now, up front, we do want to acknowledge that this webinar is drawing on learning from Australia and New South Wales in particular. However, the focus is on relational approaches, and they are fundamental to child and family flourishing in all countries and in all contexts. And our hope is that you're going to be able to find elements of these key learnings today, both in terms of what does and what doesn't work, that may have a relevance to your context, and recognizing the diversity of contexts in the room. And whenever there are different contexts, there is that need to consider contextualization. And therefore, we also have the pleasure of hearing from two discussants who have joined us today, Sai Chin from This Life Cambodia and Peter Kamau from Child and Family Focus in Kenya. And they are going to be sharing some brief reflections on how the learning might be relevant in the context in which they are engaged in child protection and care reforms, whether that's reflecting on case management approaches, alternative care services, or paradigms that underpin systems level reforms. We will have time for a Q&A at the end, so please do put your questions in the chat and feel free to upvote on others' questions so we can see which ones are being prioritized. Now, without further ado, I want to introduce our two presenters for today. I'm going to introduce them together as they will be co-presenting throughout the presentation section. So firstly, Jared Wheatley is the chair and the co-founder of the Centre for Relational Care and the founder and chief executive of Professional Individualised Care. Jared has worked across the youth and community services sector for 20 years, from coordinating youth services in New South Wales to developing and implementing programs for refugees in Germany. At the CRC, Jared leads efforts to influence policy, legislation, and regulation in New South Wales child protection and out-of-home care system to centre it on relational approaches. His leadership has been recognised with several honours, including New South Wales Youth Worker of the Year, Young Australian of the Year, and he has received the Medal of the Order of Australia for service to youth. Sophie Bruce is the CEO of the Centre for Relational Care and the Director of Adaptive Leadership Australia. As a co-founder of Systems Thinking Research Centre and a leader of programs and teams across multiple organisations, Sophie has developed a toolkit of human-centred and practice-based methodologies that have contributed directly towards national change initiatives in both the UK and in Australia. With the CRC, Sophie is pushing for systems reforms by collaborating with lived experience advocates, grassroots community organisations, peak bodies, governments and service providers to champion and co-design practical alternative systems for out-of-home care that are based upon connection. And Sophie also holds an industry fellow role with the Institute for Public Policy and Governance at the University of Technology, Sydney. So Jared and Sophie, a very warm welcome to you both joining us from Sydney in Australia. Thank you so much for being part of this webinar. And without further ado, I'm going to hand it over to you.
Wonderful. Thank you so much for that warm introduction. And it's just so lovely to be here. And I was watching the chat with people popping up from all the countries around the world. As Rebecca's already said, Sophie and I are calling in from Sydney, Australia. It's 11 o'clock at night here, a little bit past, and I've got a peppermint tea, so it's at that end of the evening. I'm calling in from Australia, and we have a cultural practice in Australia that it's always acknowledge the land we're on before we begin. I might just start there for a moment. And in my context, and also where Sophie's calling in from, we're calling in from Gadigal land. That's a First Nations, Australian, Aboriginal people, Gadigal land of the Eora Nation. And I pay my respects to their elders past, present, and future. Today, we're excited to be here and share some of our learning that Sophie from the Centre for Relational Care and myself coming from Professional Individualized Care also work with Sophie very closely. So we'll try our best to hand back and forth so you don't get too sick of my voice and Sophie's as we move through this. Today, we really hope that the professional individualized care can provide, as Rebecca said, a clear example of saying, if you're in a system that has group homes, and the words are these children are too hard to place them in a home, I really feel confident by the end of today's session, you're going to be saying that does not have to be that way. Here is a tangible example where we've been able to, for half the cost of institutionalized care, equip professionals to be able to do this care work in home. And I hope too the Centre for Relational Care can provide an example from the West of saying, what is Australia's care problem? And I would venture that it's a very similar problem that we see in the UK and America and other places on building our child protection systems on the concept of protection rather than connection. And so it's hopefully a great chance to be able to see for those countries that do have institutionalized care, another example of here is a movement that's pushing for something drastically different. And hopefully for those countries that don't yet have group homes set up as the primary intervention for government for the most vulnerable children in the system, some examples of what we could do instead. So I'm going to kick us off and go through PIC, which is Professional Individualized Care. And it's actually based on a German model of out-of-home care that's been operating for over 30 years. At the heart of the model, what we're doing is finding counselors, psychologists, social workers, people with industry recognized qualifications and a professional skill set. And we're actually placing one child to live in their home. So what this means for the young person is you have access to someone that knows how to appropriately respond to the complex trauma and attachment issues, but most importantly, someone that can actually offer a real connection and relationship rather than being in a group home where your primary interface with caring adults happens to be 8-hour shift workers. So what this looks like in the Australian context, I set this up 10 years ago. And the first young person that came into our care had 54 foster homes. So 54 foster homes by the time he was 9 years old, and then went through 6 different group homes. Now, for a child that's had that experience of an early childhood removal from family, then the trauma that you've experienced in the system, it's often in the West more generally that we see these children hitting group home models, as I've said. So this is a model that would do a one-on-one placement. So that child, rather than living in an institution, went to live with an adolescent family counselor in their home and was there really, for many years. And that's different on each individual circumstance, which I'll be able to break down in more detail. But for those calling in to think about PIC, you can think about rather than having your professional staff only working in these contexts like group homes with this cohort of children, we've moved that into a home but retained the skill set that's required often to understand these children's behaviors aren't about bad behaviors, but they're about survival strategies that we can be curious about. One last thing I'll say at the heart of the model is we haven't taken it from that behavioral lens. Often when I get referred a child, it's the government saying, Jared, we're really worried about this child, and here are a list of the bad behaviors or the things that are happening in their life. We try and take a fundamentally human approach to that, of getting to know the child and those people around the child that care for them. With that information, we have a theory of change that has 3 steps and it's based on neuroscience. And it's effectively, you're not going to be able to get a child to drop out of hypervigilance. That's the fight, flight, freeze response, if they're in relational free fall. So if we see children where there's a new 8-hour shift worker coming in and out of their life, it's extremely difficult, if not impossible, really to do the first step of change, which is to allow them to drop out of that hypervigilance. If we can achieve that and we've earned the right of that relationship and connection, that gives us a chance to move on to stage 2, which is an individual therapeutic intervention. So for each child, it's different, looking at what is their background and what do we need to put in place. And important to note here is we still do often use clinical interventions at that stage, but they're living still with a primary professional therapeutic carer that can hold that relationship. And lastly, we see phase 3, which is it doesn't happen quickly. It's often a number of years. But if we see if you can hold those connections and relationships for long enough, if you can get the right support involved, we see for a cohort of children that would otherwise be in either juvenile detention or group homes, that the survival strategies they needed to keep themselves safe can melt away for different ways to be in the world. So while we don't take a behavioral lens of how to understand children, our experience has been that over 90% of children that we've seen leave institutional care have been able to live in community, either back with family or with these professionals. And that's really something that I want to acknowledge here, that isn't about necessarily the adults involved, but how incredible children are. I've met so many kids, and for anyone calling in who's had an experience of working in group homes or going into institutions knows how devastating some of those environments can be for children. Yet I've really never met a child that if you don't give them a better environment and hold strong as the adults, and someone to be able to put their hand on their shoulder and say, I've got you, and hold that stability for long enough to see that young people do incredible things. And that's often rewire their brain and believe in connection and healthy relationships again.
Thanks, Jared. I'll just take over from there for a second to talk about the Centre for Relational Care. And whilst Jared is at that kind of frontline coalface of the system, we're also approaching the system from another angle, which is to try and infiltrate a very kind of rigid system of care that's come into effect in Australia through the last sort of 100 years, should we say. It's becoming worse and worse in terms of that rigidity. So the CRC was set up about 2 or 3 years ago, and it was set up actually as a collective, as a community of people. And these community of people were people who were working in care settings, in trauma-informed roles, with lived experience, and I kind of, got together and said, what can we do? What can we do to really try and do something to reform the way out-of-home care is delivered in New South Wales? And so that's why the CRC has set up specifically in New South Wales at the moment, because the people that set it up are living and breathing this work in this particular state. We're independent, we're not for profit, we're fortunate to have philanthropic funding, so we're not attached to any kind of government initiative, and we've got a real opportunity to do some good hard-hitting work, which I'll talk about a bit more a bit later. The premise of the CRC is that we're really working to remove the barriers to children and young people receiving the secure relationships that Jared has just talked about being so important to them. And how we're doing this is kind of like it's a paradigm systemic shift. So my background isn't from the care system, my background's from systems change. So I'm hoping to be able to put my lens on that, which is helping the system see that the current paradigm in Australia of child protection, and I will talk a bit more about what that looks like in the Australian context, is not actually protecting kids. What it's doing is protecting itself. And so we're proposing an alternative, which is what we're calling a child connection system. And our work is informed by people with lived experience. It's really important for us to engage with people who actually can inform us about what it's like being in a system that doesn't work relationally, but also in scenarios where it does work relationally, so that we can actually present what's working as well as spotlighting what the problems are. So we've also engaged with First Nations organisations and peak bodies here in Australia, fostering kinship care providers, government, psychologists, social workers, academics, policy experts. And being the Centre for Relational Care, relationships is very deep in our value set. So we believe in the power of relationships in the way that we work, and love being part of this kind of global network as well. A little bit of why we exist and why the CRC was actually set up is that there is a real urgent issue in Australia. We have 45,000 plus children that are removed from families and placed in state care across the country. There's over 15,000 in New South Wales. Over the years, 20% move placements 3 or more times, 8% move 4 or more times. I think about as a young child being told, you're no longer able to live here anymore on multiple occasions, what that could do to their sense of self and their identity. We have a real disproportionate issue here where Aboriginal children are 12 times more likely to be in care. And that's just, a really harsh statistic for us in Australia, and we really need to address that. And part of our paradigm shifting is challenging why that's happening. And for these, as Jared said before, kids living in sort of institutionalized settings means that they're growing up with adults who are rotating shift workers. So it's really tricky, to build any secure bonds and feel safe in that kind of scenario. And we can see that the repercussions that has long term as well as on the short term. On a very kind of financial, practical level as well, the spending that's going on here is it's not a money issue here. It's a very wealthy sector, but yet we've got an overspend on emergency accommodation. So out of home care spending is rising, but yet the issues are not dissipating. So many reports over about 14 plus reform attempts since the 1980s. So lots of people have been trying to reform it. There's lots of understanding that the problem is big, yet outcomes for children remain unchanged, and actually at times much worse. However, there is hope here, because there are people and organisations that are really trying to ensure in Australia that this reform is not another failed effort, particularly in New South Wales. So the people who are helping with this are people like PIC, as Jared will talk about a bit more, addressing this by offering a service, offering a way of care that moves away from institutional care, that increases the likelihood of multiple placement breakdowns and further trauma, towards this more individualised holistic care that will open up pathways for healing and transformation for young people. And on the other side of things, the CRC is also trying to address this by offering a reimagined alternative system that's based on connection, so that people, or children and young people who are experiencing out-of-home care, have safe, secure relationships. And we call them like genuine relationships, which is around connection. And so we're calling for a whole of system approach with the CRC, that we're calling for what we say, let's put our humanity back in over our bureaucracy. And when we think about those two words, they're words that we might say quite a lot during this session, and obviously in the work that we do. So just as a little bit of a kind of a step back, if we really think about what the word bureaucracy means, it comes from the French word meaning desk, bureau means desk, and the suffix is Greek, krasi, which means power or rule. So at its roots, at its most literal definition, bureaucracy means ruling from the desk, power from the desk, authority that sits behind power. And that authority comes out through paper, procedure, and policy. And what we're saying is, hey, what about humanity? We contrast that with the word humanity. It's a word that's Latin, rooted in Latin. It means humanitas, human nature, kindness, compassion, the very qualities that make us human and that make us caring individuals. And so where bureaucracy looks to systems and processes, humanity looks to people and connection. And in the work that we're doing, we see this tension every day. And on one side, we've got a system that's becoming increasingly defined by rules and forms and processes, driven by this real fear of getting things wrong. And on the other side, we have children and families whose lives are shaped by complex scenarios, vulnerability, love, resilience, all these things that form and procedures that they can't fully capture. So, how we're trying to change the system where the bureaucracy holds too much power back to being more human. So I'm going to hand back to Jared to talk about PIC as this more human alternative.
Great, thanks, Sophie. So breaking down PIC a little bit further, if we've done the introduction, you can picture the child that would otherwise be in a group home, being able to live now in the home of a professional. So the breaking it down, that what we've seen is incredibly important is to get someone with the skill set that when we see the child's survival strategies play out, it needs to be someone in the home environment that can say, I understand where that behavior's come from and I don't take it as a personal attack. This doesn't mean these people are perfect. None of us are within our own homes, but we do want to find people that have the skill set that they've been using in a professional context, say as a social worker or a psychologist, but now to apply it in a home-based environment like they would to a niece or a nephew. So we're deliberately not trying to reproduce clinical models of care in a home environment, but rather find people that have that skill set and then allow them to care for this child in their home. What's really important here is that it needs to be, from our model, one-on-one, paying a professional wage. So we're actually saying to people, our value proposition is saying, if you dreamed of this, if this was already what you said, oh, one day I would love to care for a child in this way, then we actually have a new option within the West, or certainly within Australia, to come in and say, we'll pay you a professional wage for that person to leave their job and to care for this child in their home. So there's no financial barriers for people to leave their job and to make this their primary profession, their primary engagement. What this also means is you have someone that, say, if you have problems with the child maybe at school who's getting suspended a lot, you've actually got someone there that's got the time to invest. And this flips a little bit on its head how we often see investment go in the social sector, which is the money comes to an organization and you have many adults, case managers, case workers, etc., working with the child. Here, what we're doing is taking the large proportion of the investment and putting it to the ground where it will impact on a child's life. And so we're recruiting highly capable people to be able to do this role. The second thing that we need to kind of emphasize, it has to be individualized. So I don't have a one size fits all approach or a 10-step list when government calls me and says, Jared, we've got a child in this circumstance, where I know that if you do these 10 steps every time, that's the right way to go about it. We have to find out about each child, their needs, and very importantly, their strengths, and see if we've got a match to the professional that we've been able to recruit. So each professional writes down their own professional concept. It's almost like its own organization, because you can imagine you might have an equine therapist, so a therapist that's working with horses, or it might be a professional in this case that feels comfortable working with young women, with internalized presentations around self-harm. That professional concept might look very different to a social worker I've got who lives on the coast, who has a lot of structure and routine, who takes the kids surfing, who happen to have done 20 years in group homes, who says it's actually the young men that have violence in the group homes. They can be in my home for the first few years. We have a very structured routine around surfing in the mornings. And it's from there, it's, 2 years in my home, into independent, into the granny flat, which is out the back of the property, then into independence. So both of those concepts would come under our model because it's the professional that leads them. So as close as we can get to getting decision making on the ground, and as close as we can get to listening to the individual needs of the young person, the better chance we have to provide an environment that can endure the first year. And what we see for this cohort of young people, if we can get through that first year, we usually get through the rest of the time far easier. The last thing I want to say, and I'm going to touch on it later, but it has to be care. And this is a word that's used a lot in the West. However, a lot of the children I've worked with, and I'd argue too in our aged care facilities, it's often overused. It doesn't feel like care if you're a unit. It doesn't feel like care if, like Sophie said, you're part of a bureaucracy. So really, the magic that can happen is if you can create an environment that real connections and relationships thrive. That's what we've seen saves lives. That's what we've seen changes lives. The rest of what PIC can offer is effectively a financial structure to enable a new cohort of professionals to care for children in their own home. But what changes lives is really that connection and relationship. What I've just described to you is our stationary settings. So that's the bulk of our intervention. If I hear about a young person, the most of them that we're saying it's going to be going from a group home or a hotel. So we use hotel care. So if they can't find group homes for children, we see a cohort of children also living in hotels. Most of them are young enough that what we need to be able to produce is a home environment, real people, real relationships in someone's home. Once we start that work, we can then build back in family. And for many young people, we can transition fully to family, or we can have joint care. Or it might be that they want to spend the holidays in with family, but it's us and our professionals that they'll care through ongoing. But to keep in mind there that our hope is that that endures past the system endures, because a real relationship doesn't start with an end date. So for many children that come into our care, this is the environments they come into. It's people's homes. But if we flick through these next slides, I'll run you through two other things that we do. Sometimes I'm referred children a lot later. They might be a 16 or a 17-year-old living in group homes. And there we still think it's absolutely crucial that they get a one-on-one relationship with someone that has the skill set to help guide them through. But this ends up looking more like a mentor. So we're still able to financially pay for that person to be in their life, but we actually set them up with their own apartment. And so that's what we call ambulant care. And it's still relationship based. It still has the same theory of change that you need to provide connection to children for them to drop out of hypervigilance. You still then need to have a therapeutic intervention. The difference here being it's not done inside the professional's home, but the young person has their own apartment. The last thing I want to mention in terms of service offerings that we have here at PIC is our therapeutic assessment pathways. So these are short-term and ultra-flexible interventions. So I've sent 10 social workers that at any one time are there waiting to go for when governments say, we've just had a removal and we're about to warehouse a child. And what we're often doing with them is the system doesn't know them very well at that point, and we're taking them traveling. So it might be that they have an aunt and uncle somewhere else in the state and we can take them to visit, or it might be that they'd always dreamed to go to South America. It's really can be that flexible that we're saying for a fraction of the price of what it costs to sit that child in a hotel or a group home, we can do an individualized intervention that often uses travel with a social worker to be able to find the next placement for them in the system. All of this is effectively saying, how can we provide options to government that are relationship based rather than shift work based? I've mentioned the cost. The barrier to this model is not the cost. So if the government has money to be able to pay for a group home, this will be about half the cost of that. And that is still with paying someone's professional wage. Has it been evaluated? I'd mentioned that this model's been running for over 30 years in Germany. They've had case studies of over 40,000 children going through the system. And it's been twice as successful, really, as the next form of care within the German out-of-home care system. And we've had similar results here in New South Wales. And I think the fact that this approach has had similar success in Germany and Australia shows that at the heart of the model, it's talking about relationships and connections. And, I would certainly argue I know if my First Nations colleagues were in the room here, that we're not seeing First Nations concepts of care that aren't relationship based. But the West has thought that we could do this through a system approach to caring, and that hasn't worked well. I'll just very quickly here, what's the criteria? I really fight hard to say to government we won't have one. So in terms of what age can someone enter, how long will we work with them? It has to be individualized. And lastly, why not scale? I've been operating this model now for 10 years in New South Wales, and I get many requests to keep doubling the size of my organization. We get 80 to 100 referrals each time I allow a free space in the system. So it'd be easy to scale and build an ever larger organization. But there's a few reasons. One, I think relationship-based care is better run in small organizations where the proximate adults and attuned adults in a child's life are known and children are known. So I think it's delivered better at a small scale. But secondly, why keep scaling to meet demand at the end of the system when we can do the work that now the Centre for Relational Care is doing of saying, why are children ending up here? So why do we have a system, despite its best intentions, that say we want to protect children, help them, and heal? We can find a system that's investing in our state in New South Wales $3.2 billion, and the outcomes are that many children are worse off after that investment. And the Centre for Relational Care is looking to tackle this at its heart, which is to say what underpins our system is the inherent self-interest of the system to protect itself, not the family and the children. This might be a jarring concept, and we're going to break it down a little further here. But it's to say that we have stated values in our system about protecting and helping families and children. But if that stated value is put in competition with the value of protecting ourselves, protecting our NGOs, and protecting our government, then the services that we're providing have to first go through this filter, this inherent self-interest of protection of the entity of the government. And what's that seen is that we've stated the myth of protection, where certainly the evidence within Australia is that government have kept scaling a system that hasn't delivered more protection. It's actually delivered more harm, but it has got a very powerful story at its heart, which is to say that government as authority can offer protection. At the CRC, we would argue that this protection has to come from adults, attuned adults in a child's life, and it has to come through community. So what we've been putting forward to government is a drastically different paradigm. And it's one where the family and the community are our priority, because that's where safety lives for children. There is no protection without connection. And this is the move we've been talking about, going from a child protection system to a child connection system. This approach broadly aligns with the public health approach, which is saying rather than investing $3.2 billion into out-of-home care in our state right at the end, we need to see those monies invested into relational models and relational programs for children and family earlier on in the system. There's many ways where the CRC are looking to achieve this, but we wanted to highlight just a couple of them that we can really drive home that point. So the first one here, which over the next slides, we're going to say there is nothing wrong with some paperwork. All of us need some technical forms of structure in our life. The problem can be in an anxious system if we're worried about the reputation of government, worried about the NGO's work, worried about the family. There is a gravity, an incentive towards always scaling through reforms, certainly in Australia. Every time we have a reform, we enter in more regulation, more paperwork. It's because that does an excellent job of meeting the anxious adult needs for safety. We can say, was a plan done on this X date? Excellent. But none of these plans are interventions that we would use in our own home for our own children. So on the left, you can see a staircase. And on the right, you can see another staircase. And at the CRC, we say we've got nothing against paperwork, structure, and accountability, but it has to be an appropriate amount. So doing some checks and doing some paperwork is like the graph you see on the right. It's the staircase with one handrail, and it actually makes it easier to get children up the stairs and safer. However, on the left, if after these 14 government-led inquiries, our answer each time is to add in more regulation, we have an environment where frontline workers in the Australian system, many are spending 80% of their time doing paperwork. Just let that sink in for a second. 80% of the time of that investment is spent writing about a child, not being with them in connection. The thing that the neuroscience tells us will actually change their life. So if we have a system with 34 handrails across it and we wonder why we can't get the child up, and if you flick the slide, Sophie, we're saying that this is one of the key shifts we need to achieve here in Australia, which is we need to have people over paperwork. And this comes down to risk. Whose risk do we prioritize? And paperwork does an excellent job of creating a defensible position. So within the theories around new public management within government, the primary task, they would argue, is creating a defensible position for government. And paperwork does an excellent job of that. So case notes, case plans, and even just listen to the language in that, a case. This isn't a human set of language. It's an institutional set of language. These aren't cases, they're children. So if you have any thoughts to expand on that?
So when we're talking about the shift, what we're saying is that we know what's incentivizing the protection system. But what we're saying is we now need new incentives that's going to incentivize more people over the paperwork. So that's the humanity over the bureaucracy. So things like that is to keep rules to a sensible minimum. So sometimes we get caught up in putting another process along another process along another process. So to actually really challenge whether we need those processes, listen to frontline workers to see what's really necessary. How can we streamline more efficient ways of doing things to free up time using AI to do the bulk of the administrative tasks that take away our human time. Go to the next one, Jared.
So, this in many ways, I'm conscious of the time. I want to leave plenty of time for questions, but just quickly on this point is to say, what is the primary risk we should be concerned about with a child? And at the Center for Relational Care would argue it's the risk of relational deprivation. So we think the literature and the evidence supports firmly, and certainly the neuroscience does, that children are unsafe if we don't have these primary connections for them to grow up within healthy relationships and connections. So if we have a system that incentivizes removals rather than supporting family, if we have a system that when it does removes a child from their community, we see far greater risks. So we are saying that rather than the risk being the risk that the paperwork isn't done, the primary risk that we need to orientate around is saying we can't have this child be in relational deprivation.
And so again, then the incentive is to really encourage people to see that as soon as a child is out of family, out of connection, they're at relational disadvantage. So what are we doing to actually mitigate that rather than just concentrate on those kind of physical safety and reducing that reliance on invasive monitoring?
This is a really key shift for us. It's measuring what matters. So for those that are calling in from England or America, this will sound, or many other places, sound very familiar. But we have a system based on measurement currently. Think of the KPIs that organizations have. Think about the evaluation frameworks that we put through for organizations to prove if they're doing good work, or when government commissions, so pays for services, what is the data that they want to come back on? This is a really key problem around methodology. How do we understand ourselves? And if we understand ourselves through trying to measure this work, we have a system that orientates towards what can be easily measured rather than what people in the system tell us is meaningful. I like to use the example here of Newton's laws of physics. You don't take that as a methodology in trying to understand a discipline like philosophy or love. This is really central to any system design that wants to incentivize relational care. It has to ask the people that live the system that matter the most, what matters the most to them. I just use from my personal experience to say, I've never worked with a child that's told me, Jared, you know what saved my life was a great risk benefit analysis, or a great case plan that someone wrote about me, or a great case note. They'll tell you it was Tom or it was Jane. It was people that care. And so what we're asking for here is for system incentives to listen to the people that are in the system, the family and the children, and use that as the primary mechanism to incentivize relational practice, but also to create data that's actually more in tune with the people's lived experience. This is a huge point that we say that we need to shift to real relationships. All relationships have boundaries, and that's a very healthy thing. But in many places in the West, we've picked one set of boundaries called professional distance that are based on clinical medical concepts of care. And we think they're entirely appropriate in a clinical medical concept. But if we find ourselves as professionals in a position that our job is to raise children, that's actually something deeply human and deeply important. So at the CRC, we'll say we need contextual boundaries. If you're an adult that could step in and care for a child for maybe the next 5, 10 years and into independence, that's a very different style of connection that needs a different set of boundaries, and it needs real relationships and connections, not distance. And far from being inappropriate, we think that's entirely appropriate. What we would argue is inappropriate is putting in artificial boundaries to deprive children of these connections and relationships once they're in a system. So this point for us is absolutely crucial to relational practice, which is to say we have to share of ourselves. Children feel the difference, families feel the difference, and when we get this right, a lot of our professional skill set can come in behind.
And so the new incentives here is to really emphasize relational boundary flexibility and support people through training and supervision that really is grounded in that context of how do I both best understand what relationship is in this particular context with this particular child, this particular family. So it sound when we talk about these things, it sounds really great in you know, as we say it, and in you know, the concept of it, but actually it's why isn't it happening? It's because there's still some ground truths of this system that exists. And as Jared mentioned at the beginning around this myth, the illusion of rescuing children is a really powerful story that we've really you know, clinging on to. And too many children are being removed when they don't need to be. The system actually makes it impossible to give kids the relationships they need, and what we're hearing every day that it's actually people who bend the rules or have to go around the edges of the system or carry risk load are the people that are able to really do the good relational work. The West hasn't incentivized relational care. It doesn't suit the bureaucratic business model that it's founded itself on. There's a lot of turf and competition and a power around how commissioning and funding is given out, and the metrics that come back to prove return on investment. We hear a lot of people say that they're doing relational care, but you know, one of the great provocative questions that Jared often asks is, would you accept what this and within your own family? Would you accept this for your own kids? That's again a quite a hard hitting question, and you know, it cuts to the core of whether we're prepared to actually give a bit more of ourselves in this space. And you know, we often hear that the system is broken, but actually the system is working. So the system that's been set up here is working. It works for itself. It works for anxious adults and their notions of protecting entities. And yes, some kids manage to do okay, but it's not actually because of the system. It's in spite of it. So we're really trying to call out these ground truths to really, you know, lower the waterline of why the system is so strong. And the truth is hard and messy, and truth telling is not really invited. So the work of the CRC is to really elevate truth telling through lived experience, voices. We're building a movement. There's such a great coalition of partners and supporters that are partnering with us, that are they're interested in our work, they're sharing their work with us. We don't own it, of course. Relational care is something that's you know, we don't have a monopoly on, but we really want to amplify and spotlight where it's working, and try and strengthen those positive feedback loops that already exist, as well as intervene in the loops that are causing harm. And the work is also to offer a practical alternative. We're starting the work of co-designing a model for a relational system, so for a new system. And you know, for people who are in reform agendas, this will be maybe of interest for how you might be doing this. But for people who are in developing countries thinking about how do we design a system, we hope that some of this will be useful for you. So we're going to finish off with a bit of a very big infographic that Jared is going to kind of just go through. It's a work in progress, but what we're trying to do is really show that there's two gravities that are happening at the moment. One is that is pulling us to control and the defensible position of what we see in Australia as a protection system, and the other is towards a more connected system, towards humanity, hope, and compassion. So, Jared.
Thanks, Sophie. Yeah, and I love what you said there about no one's got a monopoly on this. No one has a monopoly on relational practice. And I think of all the contexts people are calling in from that have felt connection, of course, within their community and their lives and how diverse that can look. And so this is really designed for the New South Wales context, but we've written our legislation around protection, which has tasked 56,000 staff within government, let alone all of the teachers, social workers, and NGOs, to be mandatory reporters. So we've incentivized people to report on families. And what follows that is an investigation and surveillance system. So it sees a few 100,000 families in our state alone enter that system through really good intentions to protect children. But we're seeing that the incentive of the system incentivizes report, investigate, and remove. So we have more children and the bulk of the funding going to paying for kinship, foster, and group homes rather than actually being invested into the community. So on the left, you've got the main player being government. On the right, you've got the main player being the community, which is saying we need to invest through relational commissioning. That's a long term. Really, what I'm saying there is through government being a key player, but they're the player to support and facilitate the funding. And they're funding people to keep learning, and they're funding groups like neighborhood centers, small scale, in our context, Aboriginal community controlled organizations, parent groups, community groups, in order to support each other. We see that if they need additional support to that and we want to have a centralized position, we would say that has to be through a mandate of help. So rather than the mandate to protect, it's the mandate to support family, and help is the primary intervention if government is needed. And that needs to be done with cultural authority, so understanding the context. If those interventions aren't successful, it may be that a government still wants to retain some ability for statutory care, for removal. But if so, if we've done the work here that we've said in community, we should know aunts or uncles or people within the community for them to be the carers. If for a very, very small percentage you still need intensive therapeutic models, then something like the PIC model is far better, but it should never be the goal. We should be the last resort, but a far better option than investing into institutions.
So this is a work in progress. We're really keen to, learn from others. So please do get in touch with us after this webinar if you've got some ideas around how we're trying to articulate this connection system. It's something that we're really keen to be able to start basing our co-design work on next year. We'll just leave with a couple of I think it's important that we bring in the voice of the people that really matter in this work. So we like to just finish up with the voice of young people. So this was a report that came out earlier this year. And safety means when you can have someone open up to you, someone you're comfortable with, someone that has your back and protects you from anything. That's a quote from a young person that contributed to this particular report from that came out in New South Wales. And we have a youth advisory group of young people with experience in care. And this really resonates for me. One of them said to me, we just want people to be real and human. Connection means being physically there and present. So we're really calling for this child connection system. We're really wanting to amplify the voices of young people who really want that. So you've got a QR code there if you want to find out more about us. And we've got lots of resources. We'll send out a handout on our website. Thank you very much.
Thank you. Thank you so much, Jared and Sophie, for a really fascinating presentation. I'm sure everybody who's listening in would agree we could listen to this for quite a lot longer, and we appreciate that you've taken quite some very meaty concepts and depth of experience and really condensed it down to share with us today. And as you said, there's lots of resources, and we'll also be sharing these resources in the follow-up email along with the recording so people can take a deeper dive and can also reach out. We'd now like to turn to our session, inviting our discussants to join us. So I'm going to hand over to my colleague Annie, who's going to lead us through this component of the webinar and also into the Q&A. Over to you, Annie.
Thank you so much, Beck, and thank you so much, Jared and Sophie, for the presentation. It was really extremely interesting. And as Beck said in the beginning, we have two practitioners from two completely different parts of the world who are going to react and share their reflections on the practices of PIC that you shared. We are very, very fortunate to have Se Chin, who is the Deputy Director of This Life Cambodia. Se leads operations and supports the organization's strategic planning and partnerships. Se has over a decade's experience of overseeing multiple programming and thematic areas, including education, poverty alleviation and livelihoods, child justice and protection, health, gender equality, as well as monitoring, evaluation, learning, and research. Thank you so much, Se, for agreeing to join us today as a discussant. We are also fortunate to have Peter K from Kenya here. Peter is the Director of Child and Family Focus Kenya, where he leads efforts to make family and community-based care the standard for orphaned and vulnerable children. With over 20 years of experience in child protection, Peter draws on his own upbringing in institutional care to advocate for stronger systems and institutional reform across Kenya. So I'm going to invite Se and Peter to share their reflections on what they heard, of course, during the presentation, but also share your insights in terms of how it resonates with what you see on the ground in your own context, and how these practices of relational approach, how personalized professional care resonates with the needs that you see on the ground in terms of the needs of children who are, for example, without parental care. So without further ado, Sai, can I invite you first to give your reflections? Thank you.
Sure, thank you, Annie. Thanks for inviting me to share reflection from Cambodia context. Well, for the past year, while numbers of children in residential care have reduced in the country, many remain there. Many still enter institutions, not because they are unsafe at home, but because their family lack of social and economic support. And our collective priority as a country must be to prevent unnecessary separations and reintegrate children safely into family care, drawing on Cambodia's strong traditions of extended families and community caring. Now, for me, prevention and gatekeepings are about building safety nets around families before crises lead to separation. Family need early and practical support, social protection, livelihood counseling. So institutionalizations becomes the exception. But we must avoid repeating challenges elsewhere. I think you all heard that in Australia, social work become largely compliant driven, focus more on forms than relationships. Cambodia reintegration processes risk slipping in a similar direction. I would say if the government take more and more leadership, if they have resources to lead this work fully. When tools focus only on recent tasks, we miss connection and trust and belonging, and the very things that keep families strong. Prevention should center on a relationship, a child bonds with families, the sense of belonging, and the stabilities of caregivers. So these relational indicators, I would say, should sit alongside risk, alongside risk in our assessments and a gatekeeping tool. In terms of reintegration, in our experience, it's not simply a technical process, it's a relational journey. And in our work at This Life, the most successful reintegration happened when and where the children and families relationships is strong and actively nurtured. Nurture through what? Nurture through continuous psychological support, economic support, and community monitoring. Make reintegration stable and sustainable. Sophie reminds us that the system built on control often fracture relationships, and Cambodia reintegration processes must strengthen connections, I believe, not just completing paperwork. And protection through connection works best when children and families feel seen, supported, and trusted. To sustainable, I believe, to sustain relational care, our system must value connection over compliance. At policy level, success must be measured by strengthening families, not process cases. At the practice levels, however, a social worker will need manageable caseload, supportive supervision, and time to build relationships. When we create space for social worker to listen and connect, their impacts become transformative from our experience. This is where the system reorientation, as highlighted in CLC model, become essential, embedding connection as a core outcome of child protection. Now, if you ask whether PIC type model could help children who cannot yet return to family or ordinary foster care, from my perspective, yes, and yes, particularly in the context of Cambodia, for older children and children with disabilities, especially. A Cambodian adaptation could play a preach role, and train paediatrics carers could provide a one-on-one relationship-based care in home-like setting, while long-term family and kinship option are prepared. So this would be relational, not institutional, and that could support older children and children with disabilities who are currently in Cambodia stuck in institutions. I'd like to raise a key challenge as well, is sustainability. In the context of Cambodia, most grant and most funding cycle run for 2-3 years, and while relational require consistency and long-term commitment, and to work like a PIC type care, we must embed it into a national system and government leaderships and stable investment. Now, last words, if we put relationships, not procedures, at the heart of our child protection, we can build a system that is truly protects through connection, and where every child growing up safely and with belonging and love. That's all for me. Thank you. Over to Annie.
Thank you so much, Sai, for those very, very thoughtful reflections. And a couple of things that stood out to me really were about the importance of not only looking at this as an approach, but also building the capacities of professionals who are going to, do this work on the ground in terms of working with children and young people, and how do we build the capacities of social service workforce. And Cambodia has actually done quite a bit of work in the last few years in terms of focusing on expanding the capacity of social service workforce on the ground to support children and families. I also noted very interestingly the point that you mentioned about the stability of resources for the work that, for this kind of work where to work on relations, you need a stability of resources as well. And how the challenges of shorter or limited funding windows can complicate work on strengthening relationships between service providers and children and families also is a very important aspect. So thank you for flagging that as well. Peter, could I come to you now for your reflections on what you have heard, and also how it resonates within your context, and of course your work as well on a day-to-day basis? Thank you.
Thank you. Thank you so much, Transforming Care Collaborative, as well as our great presenters, Jared and Sophie, Annie, and the team, as well as Sai. Great insights and reflections there. And for me, it's a breath of fresh air hearing about the CRC and PIC model. And I think about it from my own lived experience in institutional care for my entire childhood, as well as one that is now working in the care reform space in our context, Kenya in East Africa. And indeed, this to me is an amazing breath of fresh air and paradigm shift. And I'm thinking to myself, our governments need to hear this, as well as all that are working in the care reform and the care transition space in our country. It is spot on in many ways, and at the same time, it takes us back to basics. The basics of the heart of this model, which is about connections. It's about building relationships, and that there indeed can never be anything called protection without connection. And so these presentations and the model definitely resonates big time with our context. And it's truly a great initiative, as well as wisdom to infuse into our existing practices. And in our advocacy engagements, as well as our care reform work, we always state that indeed love, one-on-one care, as well as attention, a sense of belonging and identity, as well as safe spaces to play and learn, trusting relationships, and being part of a community are things that all children need to grow up happy, healthy, and strong. And indeed, this can only be achieved through relationships and connections. And so these are critical building blocks that are integral to all work with orphan and vulnerable children and families, as well as even with partnerships, be they governments, be they children's homes and different stakeholders. And I take a retrospective look at, for example, my years as a child growing up in care. And I remember Teacher Mercy, my nursery school teacher, who got me my first birthday cake when I was in grade 1 around age 7. And for me, that is something I've never forgotten. And it came about because of a connection and a relationship that I built with her in my nursery school years, that she could remember about me even when I had graduated from her class. These fundamentals that Sophie and Jared speak about, and that they emphasize, are exactly what we longed for and desired as young people growing up in care. And relationships and connections, we longed for that with our house mothers in the group care settings that we were at. And looking at my own life today versus the lives of many peers, those of us that had a connection and relationship with a consistent, caring adult turned out way better compared to those, including my own biological siblings that lacked that. And I must admit that the trajectory of my life changed because of an adult that related with me, connected with me, and listened to me, as well as gave me an opportunity. And so fast forward to our day-to-day work with children's homes, caregivers locally, as well as in the East Africa, region, families and children, we find that taking a posture that is anchored on connection and relationship goes a really long way. And one posture of going to their level and seeking to understand them, seeking to understand their needs and perspectives, as well as also what are their fears, and committing to journeying alongside them towards building resilience, overcoming challenges, as well as breaking barriers and bringing their dreams, hopes, and aspirations to life. It is only in putting humanity first over bureaucracy, even as a country, that we can get success and lasting change and impact. And I like that this model that our colleagues have spoken about also talks of, avoidance of, too many handrails. They create barriers and not safety, and that we need to balance safeguards with human connection. And so I remember somewhere that I read that simplicity beats sophistication. And we must understand that the needs of children and families, we must understand these needs, and we should not overcomplicate what does not need complexity, our brothers and sisters today. And so my key takeaway from today is going back to basics, back to what really matters most and what impacts those that we serve best and positively. And so I love that we need to prioritize people over paperwork. And I believe these are realities that can be, indeed, these can be realities in our context, and governments and all child protection and child connection practitioners need to embrace these models because they indeed are the answer to the orphan crisis. And to getting as many children as possible connected to families. And so they are indeed applicable to our context to some extent. But of course, it is a wake-up call that we need to prioritize the things that matter most for the good of our children and the generations to come. Thank you so, so much.
Thank you so much, Peter. That was really, really extremely enlightening to hear. And I think, one of the biggest takeaways from me after listening to you was that even though we heard Jared and Sophie constantly remind us that this presentation is from Australia and the work is in New South Wales, but the connections and relationships are really a universal marker for all care. And that is something that you really very well underscored through your reflections in terms of how, regardless of whether you are in Australia or the UK or Kenya or India, what really makes the difference for a child is the connections that they build with the person that are caring for them, regardless of whether they're in the family or whether they are in out-of-home care, in alternative care, and so on and so forth. So thank you really for underscoring that significance of the universality of relationships and connections. I really appreciate it. Thank you so much, Sai and Peter, for taking the time to reflect on this practice. And this was really important for us to really start talking about the issue in terms of bringing it up with the participants and opening it for a Q&A. So now I'm going to go through some of the questions, and we have some really interesting questions. And in fact, one of the questions that we have here is quite well connected to the reflection that Peter gave in terms of, the connections are really very important. And, a lot of times, like Rahab says, we saw care experienced people seek out these connections in their peers, in their teachers. So, how do we establish those connections? At what time do you establish those connections? When those, especially when it comes to PIC model, when it comes to the professionals, at what time does the connection get established? Does it have to be early on? Can it have the same impacts if the connection is happening when a child has been in care for quite some time? And what kind of, what are the other things that you see in terms of requirements for this to succeed? So, Jared, Sophie, if you could give us a little bit about how it happens in a more on a more day-to-day basis or in more practical terms, that will be great. Thank you.
There are some practical realities for when governments start to refer a child to the PIC model within our context. And it's usually that they've exhausted, I'm just going to have to be really blunt and honest here, they've exhausted, can they find a home-based placement? And so you see some children go through, as I said, the first child that came to into our care in Australia had 54 foster homes. Now, they would have done 56 if they could find a 56. This isn't good practice from government, but it can often incentivize government to just keep cycling children through placements rather than pick a more expensive option. It was only once a child then goes to a group home that we're often considered. Now, would the PIC model be more effective if you could intervene earlier? Absolutely, it would. For no other reason than why would you put a child through those repeated experiences that are so damaging to their attachment and their view of themselves? So, what is the right time? I'd say it's the right time of any time you couldn't find family and you're considering an intervention like anything that's got shift workers. Then it's time to look at a model like ours. If you can find family and support the family to do the care work, that should be the top priority. And it will be at a fraction of the cost, even though my model's a fraction of the cost of the group homes. So it's still significantly more expensive than supporting families appropriately. I can expand on that if we need to. I'm not sure how many questions we have here and how quickly you need me to run through them.
No, well, one of the things that is also interesting is that because you were talking about at what time, and any time is good time, because sometimes it's already too late and some other ways it's never too late. You have to respond as soon as you have the opportunity. But Rahab also was curious to know, how do we establish these connections with care levers? Do you have any experience of having worked with or having been in contact with young people who have already left the care system, so to speak? And how is are there any experiences on that front?
I think in many ways it's what can we do to remove the barrier to something that's actually incredibly natural and human. So people want to connect, and particularly, I was struck by Peter's reflections, just speaking about the hunger in those environments for the connection and relationship. And for many young people that leave care systems around the world, they're still hungry at 18, 19, and 20 and going into adolescence. And often we have structural things within our community and society that make that connection harder. But in my experience, it's more about removing the barrier to the connection than it is about artificially having to find a way to connect. People will do that if we create a holding environment for it. What I mean really practically is saying, if you give a child, whether they're a care leaver, whether they're 17, 19, or they're an 8-year-old, my strong experience is you give that child the ability and the environment to connect. And it's actually something that we can rest. We don't need to solve. It'll happen natural because we're human and we'll want to connect with them and they'll want to connect with us. Now, does this guarantee that in every context you're going to have a great relationship? Of course not. No one's got a way to guarantee that. But we can remove the barriers that are getting in the way of it being healthy. I often try and use examples here for people around like when we're in a professional mindset, we often think of it as a task to build rapport or build relationship. Whereas we're saying, what do we do in our own personal life? What would we do with our own children? What do we do when we meet people? And it's often in the professional context, we want to put a lot of the criteria around it. And I often joke that I've never met someone at a party and said, let's be friends for 2.5 years. Or met someone and said, let's be connected, but only Wednesdays and Thursdays between 3 and 6. These are artificial constructs of which we're trying to do relationship. And the more we can say, I'm Jared, I've got a 4-year-old daughter and a 6-month-year-old son, and I enjoy playing Australian rules footy. And before I've listed a few of those things, we'll find something common and we'll start talking. And often we've got the honor to bear witness to a special moment when people feel like, hey, I see you. And people are hungry for that. They ultimately want to belong, they want to be seen. And it's more about how do we get out of the way and get back to, our humanity.
Thank you. That was extremely insightful. Sophie, without putting you on the spot, but you are in the spotlight, I wanted to ask whether you have any reflections on how a similar approach could be made a little bit more systematic in terms of working with people outside of the care system, so to speak. Because, as we heard from Peter, as we have participants reflecting on them establishing such connections with their peers or with their teachers, do you think the learnings that you have from PIC and CRC, can be utilized outside of the care system? And could you give some insights about how it could be done effectively?
Yeah, I mean, I'm married to a teacher, so we have a lot of conversations about what uh, the influence that a teacher has on children. And when we're thinking about a connection system, we're thinking about teachers, we're thinking about sports coaches, we're thinking about religious organizations, we're thinking about the people in the shop, we're thinking about the community center. So all of those people add to that kind of network of connections that hold a child in community. And there's something so nice, I know, about having kids who've grown up in a particular community. There's something so nice now, they're young adults that people say hi and I remember you from when you were 4, and it's not like they've got to have a deep relationship with them, but they know that they're there and a constant and they're looking out for them. So the work that we do is almost like, it's that microcosm ecosystem of the village piece, but how do we put that into a big system piece as well? So working across health, education, justice, all of those departments. If a child's connections and a child's relationships are at the forefront of every policy decision that's made across all of those sectors, how different might the way that government works together be as well? So definitely connections on a micro level in the community, in the village around a child, but also on that macro level, if we can always think about a child's connections as being the central point of every policy decision, that would make things so much different.
Thank you so much. We have another very, very important and interesting question, which is about really working with the professionals for them to be able to work effectively with children and youth. So what kind of training, capacity building, and support that these professionals require so that, they can work better with the children and youth when children and youth are in their care? So how do you actually develop that support and training component, and how is it administered? Jared,
It'll
do you
be
want to take it?
Yeah, I might take that and say, on a practical level within the organization I run, there's a bit of a running joke that we say the answer to every question is it has to be individualized and relationship based. And, that's exactly the answer here, like to many questions about the organization I run, that we already have people coming with a high skill set. They've got a degree in something. Then they've usually had 20 years of professional work experience. It's not often that they need from us a weekend course in something. What we actually do is we build in, so we have therapeutic specialists, we call them, but effectively clinical psychologists, and we tailor in saying for this child's particular needs and what we might see come up within the home environment, there needs to be a reflective space. And every now and again, we need to build in something to directly upskill, because we found out the child actually has fetal alcohol syndrome. And so that there's a skill set that might needed to do additional training. But we don't try and do blanket training that is the same for everyone, because every child's different. Every professional we work with comes in with a different skill set. What I would say is I don't think it's possible to do this without reflection space. Now, some people do that better in a group. Some people do it better with external supervision. But if you want to have this close within the home, it's very easy, even if you have the professional skill set, to find yourself burning out or having blocked care. And so it's really important that for those people that choose to do it in their home, in a close way, that they're reflective of themselves in that relationship and have spaces to be able to understand what's happening in relationship dynamic. And what's key in that is what we call the balcony view. So who is going to be part of that care network to be able to support that professional do the work? So we have the child and the carer and the relationship, but for us, we always have a role that's called the coordinator. And the coordinator is across 5 families, and they play the role, the first role, to help visit the child, make sure there's multiple adults that are seeing the child regularly, that they've got a relationship with, but also observing and helping the professional therapeutic carer to reflect. So on top of that, then we have clinical supervision. The short answer is we really believe in this. It's actually a huge part of making it successful over the long term is how can you support the carer to sustain that relationship?
And if we have time, we have one more question in terms of the formalization of these placements. So could you share a little bit about how formalized these are? How are these placements formalized? And we are trying to move away from the bureaucracy and focusing on the relationships and connections. But are there still some bureaucratic elements associated with it in terms of the formalization of the placement, etc.?
This is go back to that staircase analogy. We actually believe in handrails too. We think we do need a little bit of it. It's just if we've got our frontline staff spending 80% of our time on it, we'd overcorrect it. But no, there is within our model, we're doing all of the same probity checks that you'd be doing in other home-based care in the West. And we fulfill all of the accreditation for the Australian system. What I would want to pull out here, though, is something unique to our model that we think is very important. And I referred to it earlier. It's setting up the professional concept. So the professional concept is the direct offer of that particular professional, who they feel comfortable working with, what are the therapeutic underpinnings or the modalities that they use within that context. And we actually formalize this into a document, and it becomes the key document to guide matching. So to find a child that would be suitable for that. And that is unique. That isn't the system asking us to do that. We believe in doing that so that we're clear as an organization what model are they running in that home, but also it helps inform the match. And it has the added benefit of showing how the robust thinking behind this person's, some of it is their qualifications and their underpinnings, but some of it is as simple as saying, and I've got 2 dogs in the home. And you know what? For one young person, when you're talking about a potential place to live, that might mean more than all of the other things you could possibly write down about that environment. And I just want to say here, it's this moment that Peter brought up about the cake. Yeah. And it's the same what I'm saying there about potentially it's a dog, that we don't know what that moment is that can have an impact that can change someone's life. But we're far more likely to have it if we recognize it as the central thing that changes someone's life.
Thank you so much, Jared. And I know we have only a couple of minutes left now, but thank you so much, everyone, for all the wonderful questions. And thank you, Jared and Sophie, for responding to those. Beck, can I pass it over to you now? Thank you.
Yes, thank you. Thank you, Annie, and thank you, Jared and Sophie, and also once again to Peter and to Sai. It's been a fantastic webinar. I'm sure everyone who's participated would agree. Really insightful, really wonderful learning, and I think it's going to give all of us a lot to go away and mull over in terms of what does this mean in my context, of which, as we've already discussed, there are many, many diverse contexts represented in the virtual room today. So once again, Jared and Sophie, thank you so much for being with us today. It's been very, very insightful. Peter and Sai, thank you so much for also being with us and sharing your reflections in your context. Thank you to everyone who has joined from various countries and different organizations. And I just want to remind you that we will be sharing the webinar recording in a follow-up email. If there was any pressing questions that were not answered or questions that pop up in the middle of the night or later in the day for you that you also want answered, then think about those. And also, as Sophie mentioned earlier, they're very happy for people to reach out and connect further, and the information will be in the follow-up email about how you can do that. When we do hang up the webinar call today, you will find there will be a survey that's going to pop up. If you could kindly take a couple of moments just to complete that, that gives us really helpful information to help us structure and shape future webinars that are beneficial to the community. And that brings us to our close, and we've done very well to be right on time there. So well done everybody for being able to keep within our time limits and really put forward a really fantastic webinar. So thank you all once again, and we look forward to seeing you in the next webinar series that will be coming up later on. So thank you, and good morning, good day, good evening, good afternoon, wherever you are in the world. Thank you.
Thank you.
Thanks, everyone.